Myasthenia gravis is a neuromuscular disorder that is usually caused by an autoimmune problem. Autoimmune disorders occur when your immune system mistakenly attacks healthy tissue. In this condition, antibodies, which are proteins that normally attack foreign, harmful substances in the body, attack the neurotransmitter substance acetylcholine, which is a crucial substance for communication between nerve cells and muscles. This results in muscle weakness. The exact cause of this autoimmune reaction is unclear. Myasthenia gravis occurs in all races, both genders, at any age. It is not a disease transmitted by intimate contact or any type of contact. The voluntary muscles of the entire body are controlled by nerve impulses that arise in the brain. These nerve impulses travel down the nerves to the place where the nerves meet the muscle fibers. Nerve fibers do not actually connect with muscle fibers. There is a space between the nerve ending and muscle fiber. This space is called the neuromuscular junction. When the nerve impulse originating in the brain arrives at the nerve ending, it releases a chemical called acetylcholine. Acetylcholine travels across the space to the muscle fiber side of the neuromuscular junction where it attaches to many receptor sites. The muscle contracts when enough of the receptor sites have been activated by the acetylcholine. In myasthenia gravis, there can be as much as an 80% reduction in the number of these receptor sites. The reduction in the number of receptor sites is caused by an antibody that destroys or blocks the receptor site. Antibodies are proteins that play an important role in the immune system. They are normally directed at foreign proteins called antigens that attack the body. Such foreign proteins include bacteria and viruses. Antibodies help the body to protect itself from these foreign proteins. For reasons not well understood, the immune system of the person with myasthenia gravis makes antibodies against the receptor sites of the neuromuscular junction. Abnormal antibodies can be measured in the blood of many people with myasthenia gravis. The antibodies destroy the receptor sites more rapidly than the body can replace them. Muscle weakness occurs when acetylcholine cannot activate enough receptor sites at the neuromuscular junction.
Biochemical changes. The zone specifically connected with the neural axon is a neuromotor, a zone of the cellular membrane of the muscular fluted fiber that forms a depression with folds, adapting to the nervous complexion, which increases notably his surface. The synaptic cleft is between the axon and the plate. The acetylcholine liberated by the nervous complexion in this crack reaches the plate motor road, where it intergesticulates with a few specific cholinergic recipients, giving place to a modification of the potential of membrane action, up to obtaining one that is sufficient as to be transmitted to the whole muscular membrane. That is to say, the chemical impulse provoked by the liberation of acetylcholine for the nervous complexion and later activation of the recipient cholinergic transforms into an electrical impulse. Two types of cholinergic recipients exist in the plate motor road, with different affinity towards the acetylcholine. The importance of this is that in order for the muscular activation to take place, both types of recipients must be activated at the same time to form a structure in the shape of channel, which facilitates the ionic flow between the exterior and the interior of the membrane of the muscular cell. This flow is, precisely, the thing in charge of the modification of the potential of action. The opening of the ionic channel answers biochemical phenomenon to the acquaintance of all or nothing. It is to say, the potential of action alone starts when a sufficient number of cholinergic recipients of the plate motorboat are occupied with acetylcholine. When this does not happen because the antibodies block the recipients, the whole process is compromised.
The symptoms of this disease are problems walking upstairs or lifting objects, difficulty breathing because of muscle weakness, difficulty swallowing or chewing, fatigue, drooping of eyelids, double vision, and the severity of the symptoms typically increases over time if left untreated.
Signs: weakness on the voluntary skeletal muscles, trouble talking, facial paralysis, dyspnea, and hoarse voice.
For the diagnosis, it is necessary to do a neurological exam that consists in checking the reflexes, looking for muscle weakness, checking for muscle tone, making certain the eyes move properly, and testing sensations in different parts of the body. Some other tests that may help the diagnosis of this disease are repetitive nerve stimulation test, blood testing for antibodies associated with MG, endrophonium test, and imaging of chest.
Treatment. Myasthenia gravis is one of the most treatable neurological disorders, and it can generally be controlled. Before starting the treatment process, these factors should be considered among others: severity of the disease, distribution, rapidity of disease progression, age of the patient, location of muscles affected, and other existing medical conditions. There are several treatments available to help manage the symptoms of muscle weakness, and many people with the condition are able to live relatively normal life. There is a surgical treatment, which is the thymectomy. This procedure consists in the removal of the thymus gland. It is recommended for thymoma, which is a tumor in thymus gland, to avoid complications caused by tumor spreading. And it also reduces and eliminates symptoms in people without thymoma. Since the thymus gland has to do with the immune system, this procedure may allow patients to stop taking medications, and it might cure patients possibly by rebalancing the immune system. Medication treatment. Cholinesterase inhibitors such as pyridostigmine and neostigmine help improve neuromuscular transmission, increase muscle contraction, and increase muscle strength. These work by blocking the action of acetylcholinesterase and increasing the amount of acetylcholine in the neuromuscular junction. Immunosuppressants and corticosteroids are used to alter the immune system. These improve muscle strength by suppressing the production of abnormal antibodies. The most commonly used are prednisone, azathioprine, cyclosporine, mycophenolate, mofetil, and tacrolimus. Plasmapheresis. The plasma exchange consists in the removal of antibodies that block the transmission of signals from your nerve endings to your muscle receptor sites. It is a short-term treatment since beneficial effects last only a few weeks. Immunoglobulin therapy. This treatment provides your body with normal antibodies from donors. It changes the way your immune system operates. Lifestyle changes. Certain things help alleviate symptoms of myasthenia gravis, such as get plenty of sleep to help minimize muscle weakness and avoid stress and heat exposure.